Ready when you are, Mayor.
Well, good morning. Since our last update, the CDC announced new recommendations for vaccinated individuals. Their announcement further bolstered the case that mass vaccination will provide the safest end to the pandemic. I want to make it clear that's what the CDC guidelines essentially provided, that mass vaccination will provide the safest end to the pandemic. Their recommendations have also created understandable confusion for residents and businesses in Marion County, with several key takeaways in seeming or apparent conflict with local restrictions. That's why, after careful consideration, careful evaluation by the Marion County Department of Public Health, led by Dr. Virginia Kane, we joined together today to lay out a clear path forward for our community to a full return to normal. While the Marion County Health Order that is currently effective remains in effect presently, on June the 7th, we anticipate that we will be in a position to further loosen public health restrictions. So, you may ask, why June 7th? Well, several reasons. Most importantly, that's another 2.5 weeks worth of shots in arms that will increase our community's vaccination rate, further hampering the potential spread of the virus. Additionally, June 7th would get us beyond one of the largest events, if not the largest event in the world since the start of the pandemic, this year's Indianapolis 500. And frankly, June the 7th gets us past many other important events, graduations, proms, and more that will be held before the end of this month or in the early days of next month. And we want folks to enjoy these larger social events, but we also want to ensure that we are doing it as safely as possible. And lastly, June 7th coincides with the next meeting of the Indianapolis-Marion County City-County Council, which, as you all know, now must approve changes to public health restrictions pursuant to state law recently passed by the Indiana General Assembly. As part of those changes, we anticipate increasing the capacity limitations for religious services, large indoor sporting events, social gatherings, and more. Dr. Kane will walk through the specifics of those in just a few moments. Additionally, at that time, all of us who are fully vaccinated will no longer need to wear their masks unless a business or a venue asks that you do so. The new CDC guidance made clear that what we have said throughout the past several months. It is the vaccine that is getting us back to normal. The vaccine is getting us back to normal. The more people who choose that option, the stronger and the faster will be our recovery. And through additional resources and encouragement, I believe that by this July, we can rally to have at least half of our eligible population vaccinated. Reaching that goal could allow us to further reduce the restrictions that keep our population safe. So, if you haven't scheduled your shot, please visit ourshot.in.gov. That's ourshot.in.gov, or call 911 and join with us in a safe, quick, efficient return to normal. That's the goal that all of us share. And now I know we'll want time for questions, so I'll pass things along to Dr. Kane to provide more detail on data before we open the floor. Dr. Kane?
Thank you, Mayor. This morning, I bring a message of cautious optimism for our community. Our cases and positivity rate are trending down. And every day, our members of our community are making the choice to protect themselves and those they love by getting the COVID-19 vaccine. And last week, the CDC released new guidance for fully vaccinated individuals that makes it clear that the COVID-19 vaccine is safe, it's effective, and is our way out of this pandemic. Now, in line with this new guidance, we will be making a recommendation to the City County Council on June the 7th to lift Marion County's mask mandate for fully vaccinated individuals, with the exception of certain settings, including hospitals and public transportation. So if you're in a hospital and you're fully vaccinated, you still must wear that mask. So I'm giving you the exceptions: hospitals and public transportation. So like the airport, local bus transit. Now remember also, fully vaccinated means individuals who received their final dose of the vaccine at least 2 weeks prior. If you have not yet received your COVID-19 vaccine, now is the time. Visit our shot.in.gov or call 211 to register for a vaccine appointment. Or you can walk into one of the health department's clinics today. Vaccine works best when we're all doing it together. And when you're vaccinated and the people around you are too, everyone is safer. So the Marion County Public Health Department and the City of Indianapolis, we're continuing to focus on breaking down the barriers to the vaccine and educating our residents on its benefits, though. A voicemail to assist Spanish-speaking residents in vaccine registration that is available at 317-327-2108. So a voicemail to assist. If you're Spanish speaking only, call that number, 317-327-2108. We got a hotline for those with any questions about the vaccine and registration. That's a simple number, 317-221-2100. 317-221-2100. Now, inserts of information on the vaccine, as well as IU's health program, is providing free rides to a vaccine appointment. That were included in mailers to over 3,000 residents. And we're going to try to reach an additional 4,000 residents by the end of the month. You need a ride, you can get it free through IU Health's program. Continue pop-up clinics with our community partners, and vaccine registration assistance at community events will continue. We're investing $1 million in community-based organizations serving minority communities, with announcements on these grant awards now expected by May the 31st due to the high volume of applications received. And partnering with the city, with community organizations to host another vaccine registration hotline, this time with multiple languages available for residents. So we're currently searching for volunteers. So if you're bilingual in Burmese, Haitian Creole, Hakka, among the other languages, please sign up to volunteer with us. More information will be available on Twitter at Marion_Health. Now, in addition, these data changes significantly on June the 7th. We will also be recommending to the council a loosening of capacity restrictions. So religious services and funerals will move up to 100% capacity. Indoor sporting events will move to 50% capacity. Limits on large gatherings will increase from 50 to 500 people. Indoor services at bars, restaurants, and other businesses all will move up to 75% capacity. Personal service businesses will no longer have to be by appointment only, but we ask that you make sure that capacity allows for 6 feet of social distancing between your non-vaccinated clients. And entertainment and culture venues can now host up to 75% capacity. Now, this new guidance from the CDC has also made clear what next steps look like. The health department will recommend the full reopening of our community to the city county council when we reach a rate of 50% fully vaccinated residents and are seeing less than 100 cases per day. It is my hope, and I have confidence in our city, that we will reach this milestone by this 4th of July. Now, here's where I offer caution. This welcome news for our community does not mean that the end of the pandemic is here yet. Our progress gives us hope that there's light at the end of the pandemic tunnel, but we can't be blindsided by the light. So if we continue to do the things that we now know protect ourselves and those we love from COVID-19, getting the vaccine, washing our hands, and continuing to social distance and wear a mask for now, the full reopening of our community is within our reach. And now I will walk you through the current COVID-19 data for Marion County. As you can see by this Marion County data in Indiana, that we are on a downward trend. Next slide. And we are now have reached the positivity rate of 5.8% as of May the 11th. Gold standard is 5% or less. Next, and we're on the downward trend now with our positivity rate. Next slide. When we look at our newly confirmed cases, you can see that we had almost 180 cases averaging per day. And we're definitely on the downward trend where we're now at 113 cases averaging per day on a 7-day average. Again, getting close to our indicators for reopening this city. Next slide. When we look at our ED visits with COVID-19 symptoms, since early May, we have now plateaued and remained flat with the number of visits going to our emergency rooms. But as you can see here, we are averaging about 33 visits per day. Next slide. Our first time hospital admissions for persons with COVID-19 again are trending downward, and we're averaging no more than about 12 hospitalizations for COVID-19 a day. And so a huge accomplishment where we're not seeing our ERs flooded and our hospitals overwhelmed. Next slide. Our death rates are averaging 1 a day. And so even though we're seeing an increase in our deaths, we're still averaging no more than 1 death a day. Next slide. How do we compare to other large Midwestern urban areas? Well, we're experiencing 14 new cases per 100,000 residents, same as Chicago at 14. Detroit is the highest at 22 new cases per 100,000 population, with Columbus, Ohio, and Milwaukee and Cincinnati lower than our new cases occurring on a 7-day average. Next slide. When we look at how we compare to our surrounding counties, we see for new cases per 100,000 residents that Marion County is experiencing 12 new cases per 100,000 through May the 17th. And we find that Hamilton, Boone, and Hendricks, Morgan, Johnson, and Shelby are near these slightly lower rates of new cases per 100,000 population, with Hendricks and Morgan and Shelby the lowest. Next slide. When we look at ourselves and look at from a state standpoint of how many new cases are taking place for 100,000 residents, you will see that Michigan, the state, has the highest at 20 new cases per 100,000, compared to Indiana, Kentucky, and Illinois, where we're both ranking at 12 new cases per 100,000 population, with Ohio slightly lower at 9 new cases per 100,000 residents in our state and surrounding states. Next slide. Age distribution, we continue to see a rise in our residents under the age of 20, who've now risen for the month of April up to 23%. I'll explain a little bit about who I think is contributing to those cases, followed by the largest age group that's contributing to our cases remains the 20 to the 39-year-olds, making up nearly 50%, almost half of our cases. So your 20 to 39-year-olds, you're the ones who really have to emphasize the need for being vaccinated, because you're contributing to over almost half of all of our cases reported in our community. Followed at 25% for our 40 to 59-year-olds. And again, we're making huge gains with only 7% of our cases in the age group 60 and older. And we believe that is predominantly related to our very high vaccination rates in that particular age group. Next slide. This slide highlights, and if you can see that very large navy blue surge, as you can see, that happened in January, and even had a much bigger surge, a much lower surge that occurred in early April, we believe, related to the spring break, where we saw our 18 to 24-year-olds contributing the most to our cases, but now are trending downward. Our adults are in the next group, but still experiencing less than 25 cases per day on an average basis. And our K through 12 also looking at less than 15 cases per day. So our less than 5-year-olds and our K through 12-year-olds are continuing to look good numbers related to new cases occurring in our community. But all of them appear to be on the downward trend through May the 17th. Next slide. We're looking at our vaccine doses that have been administered. And as you can see, we were at our height of giving vaccinations in early April. We've seen sort of a slight decline in people getting vaccinated going through the first 2 weeks in May, but we have continued to have enormous challenges to make sure that people have an incentive to get vaccinated based on the benefit related that you can have for our community returning close to normal. Next slide. So where are we in terms of Marion County residents being fully vaccinated? We are at 31% where we are fully vaccinated. And so we know we're capable of vaccinating at least 10% of our community every 30 days. But we can even go higher at 15% to easily, we need to meet that early July deadline. Next slide. If we look at how we compare being vaccinated compared to our surrounding counties, Marion County is at 32%, and very similar to Johnston, Morgan, and Shelby County. But you will see that Hendricks, Boone, and Hamilton and Hancock are at nearly 10% higher in their individuals and residents being fully vaccinated compared to Marion County at 32%. One of the issues that continue that we realize is that about 40% of the vaccinations we give to people in Marion County are not residents of Marion County. All the vaccinations that we do in Marion County, because of our efficiency, because of our availability, 40% of who we vaccinate are not residents of Marion County. Next slide. Next slide. So when we look at who's fully vaccinated by age group, you can see that if you're over the age of 60, at least 60% or higher, like in your to 75% are vaccinated over the age of 60. So we're doing a great job with the vaccination in our older age groups. But we have our work cut out for us because of the largest number of cases which are occurring between 20 to the 39 years of age group. You will see that we are in the high 20s in terms of their being vaccinated. And we really need to bump them up. Everyone from 20 years of age up to 60, we need to bump them up to at least over 50% vaccination rate in a number of these groups in order for us to be fully vaccinated at 50%. So this is the group we really need to challenge and get our numbers up. Next slide. If we look at it broken down by race and ethnic populations, you will see that our white community, we're fully vaccinated at 33%, But when you look at the Black and African American population and our Latino X population, we roughly have just 18% of those respective racial groups vaccinated. So we're at about a fifth of them being vaccinated compared to our Asian community at 20%. And overall, Marion County again at 31%. Next slide. So on June the 7th, the health department will recommend to the council that all religious services and funerals, which are currently at 75% capacity, will go to a full 100% capacity. Our indoor service in bars and restaurants, which are currently at 50% to 75% respectively, will all be at a 75% new capacity. Personal services like, going to the barber shops or hair salons, which currently requires an appointment, will no longer be required, but we do continue to recommend that your customers should be 6 feet in terms of social distancing of your clients in your shops. And indoor sports are large events that are currently at a 25% capacity. We're now recommending a new 50% capacity. Entertainment and culture venues that are currently at 50%, we're recommending to increase that capacity to 75%. Large gatherings, which are currently at 50 people, we're recommending up to 500 people. And so additionally, the health department will recommend lifting our Marion County's mask mandate for fully vaccinated individuals. Thank you, Mayor.
Thank you, Dr. Kane. Thank you, Mayor. At this time, as always, we're going to switch to the question and answer portion of today's health update. I will call on and unmute folks who put their name and outlet in the comments. I anticipate there are going to be a lot of questions, so if we can hold to one question at a time, and then folks can feel free to put their follow-ups in later. The first question is from Leslie Bonilla at IBJ. Leslie.
Hi, Mark. Thank you. One question, in terms of the recent restrictions for vaccinated people, and you guys mentioned this at the last update, but how will business owners or other venue operators be able to tell the fully vaccinated people from those who aren't?
So if you don't mind if I can answer that, I think we're going to try to rely on the honor system, okay? So we're following the CDC guidance as it relates to fully vaccinated individuals. And our communities work really hard to help to control the spread of this virus. Just so far, I believe we can continue to work together to cross that finish line. So we're having businesses asked on an honor system whether your individuals are vaccinated or not.
Thank you, Dr. Kane. Next question is from Sherry with the Star. Sherry. Sorry. There we go.
Hi, thank you. I appreciate. Can you tell me, would you have been able to call the city council into session if you wanted to lift these restrictions earlier? In other words, how much were these restrictions mediated by the fact of when the next city council meeting was under the new law from the legislature?
Yeah, Sherry, I'd answer that by saying it is not unusual under special or emergency circumstances for the administration to make a request of the council to call a special session. I don't believe that I do that unilaterally. At least I have not in the past. In other words, I've always done that by requesting the president of the council to call a special session. So it's a collaborative endeavor. But specifically, I think the June 7 date is quite appropriate for all the reasons that we've already given. And that is, not only is that a regularly scheduled meeting of the council so that the president of the council doesn't have to make that request, but also because it gives us 2.5 more weeks, as I said, of additional vaccinations. It gives us 2.5 weeks that will see the largest single-day sporting event in the world, I think, come and be done successfully and safely. And then at the end of May and early June, there's a lot of social gatherings around proms and graduation exercises, and so people gathering together. Long story short, it gives us 2.5 more weeks to see where we are at that time, and therefore make a more informed and better decision about going forward. What Dr. Kane, I think, to her credit, has done is essentially outline what we hope that we are in a position to recommend on June the 7th. So it does give the people of Marion County a roadmap as to how to get there and what will happen in terms of these restrictions or lifting them when we do get there.
Thank you, Mayor. Our next question is from Mary Mills at the WTHR. Mary?
Good morning. I think this is for Dr. Kane. For the last several months, you've been saying in order to remove or loosen restrictions, we needed to reach a herd immunity. I believe you said 70 to 80%, if I'm not mistaken. And now it's 50%. Is that correct? Am I understanding that right?
That is correct. So why the change in my goal for being vaccinated in the community? Our latest science shows that individuals have protection from COVID for at least 90 days following diagnosis. So we have a significant number of our residents who are being newly diagnosed with COVID, and that immunity, a minimum of 90 days. So when we look at that, because they're protected, and we currently have about 30% of our community who has this protection, when you add our 50% of folks who will be fully vaccinated, plus now this 30% of our community because of recent diagnosis and now have immunity for at least 90 days, that gives us about 80% herd immunity that we have been aiming for.
Thank you, Dr. Kane. Our next question is from Russ Dodge of WITT. Russ.
Yes, for Dr. Kane here, I want to get a little clarification, if I could, on the event and the sport capacity there. You had outdoor events, you had indoor events, and different percentages there. There's maybe a little bit of confusion on that, if you could clarify.
So for the indoor events, we have had our capacities at 25%. And so for the indoor event, we are now increasing that capacity from 25% of spectators or patrons, or however you want to call it, to 50% indoors. And for our outdoors, basically, there's no requirement for outdoors unless it's a large event.
Okay.
But we're staying at 50% for our outdoor capacity for outdoors. So now We've gone from 25% indoors to 50% capacity, and we will be remaining at 50% capacity if you are outdoors.
Thanks, Dr. Kane. Our next question is from Abdul at Indie Politics. Abdul.
Good morning. Dr. Kane, my question for you is it's about not so much herd immunity, but do you think that with the folks we've seen get vaccinated so far, that we basically hit almost sort of hit a plateau, that anybody who actually wants one or desires to get a vaccine for COVID-19 has gotten it? And then how do you reach those other folks, other people who are just skeptical or just don't want to get a vaccine?
So let me just say that, we had that pause with the Johnson & Johnson vaccine, and our vaccinations actually sort of lowered off a little bit. And currently right now, we're maintaining at least a 10% of the population increasing every 30 days currently at our rate. But I gotta also say that we're trying to do all these different initiatives to help try to get those folks who are hesitant. For example, we think by investing $1 million in our community-based organizations serving minority communities who are hesitant, our Latinx population who may be hesitant, that these organizations that reside in these neighborhoods, work in these and evolve in these same social networks, will be more trusted ambassadors, carrying out the message, addressing any myths, and talking about the benefits and safety of the vaccine. We think that will be huge in making big differences. We also think by doing mobile pop-up vaccination clinics in those areas where we have a high percentage of folks not getting vaccinated and involving members of their community will be significant. And we will continue to do things like voicemail to assist anybody who can't speak the English by helping to register them and get them to vaccine sites, and talk about how transportation was free if that's an issue. So we've got a number of things that we are working on, but I wouldn't mind Governor Holcomb offering $5 million, in some kind of lottery that people who are vaccinated that could be an incentive for them. So I'm waiting to hear from state government to see if Indiana will match what Ohio is doing for an incentive.
Thank you, Dr. Kane. Our next question is from Russ McQuaid of Fox 59. Russ.
Well, thanks for those comments, Dr. Kane. Unfortunately, I just got my shot, so I guess I'm not in line for any sort of lottery unless you have a special dispensation for that, but I'll bring that up next time I talk to the governor.
Please.
Is it time? Okay, thanks. Is it time to raise the guidelines and raise the ban on 24-hour service for restaurants that operate around the clock?
Dr. Kane, I can answer that one.
Thank you, Mr. Babcock.
Well, Russ, first, there's always special dispensation for great journalists such as yourself, but that ban on 24-hour restaurants was lifted in the last order. If you go take a look at it, it should be there.
Thank you, Paul. We'll hold just a minute. I think those are the questions that I see. So if folks have believed to have submitted their questions, you may have to do it again if it's not up, but we'll pause for just a minute. All right, we're going to really quickly go back to Mary Mills. Mary?
Question, 75% for restaurants. It's been at that level, I believe, if I'm correct. I know that restaurants have been concerned. Does that mean that social distancing requirements are gone? Because they've said it's hard to even get to 75% if you're still maintaining that 6 feet of social distancing.
So, Mary, we're trying to look at that a little bit carefully. We would love to continue that 6 feet distancing, but that is something that we're going to try to look at in the next week or two to see if there's any kind of way we can reduce the amount of social distancing to maybe 3 to 4 feet. So that is something that we're trying to investigate right now.
Thanks, Dr. Kane. Mayor?
Yeah, Mark, I would add to Dr. Kane's response that I would encourage all restaurant owners who are able, that now that we are quickly coming up on June 1, I know that last year in the very depths of the pandemic, restaurants were able to successfully open up outdoor seating and increase capacity by patio dining and outdoor dining. And certainly the city stands ready to work with restaurant owners who do understandably have concerns about social distancing within their indoor seating capacities. We look forward to working with particularly dining establishments to help them increase their outdoor capacities as well.
Thank you, Mayor. We've got a follow-up from Sherry with the Star. Sherry.
Hi, thank you. Dr. Kane, I'm wondering, could you just walk me through again? I think I may have misunderstood. Are you saying that 30% of Marion County residents have had COVID in the past 90 days? Could you just sort of go over that 30% number that you're hoping to add in with the 50% that you're hoping to achieve?
So when you have a number of cases, you try to determine how many cases that you're having and how many cases have you had like in the last 90 days. And so based on those number of cases, you can look at what percentage may be immune. And you also have to understand that they believe that that's the minimum, the rule for immunity. But, you know, COVID patients who have been diagnosed may have immunity even longer than the 90 days. So we feel that with that additional number of cases that we're experiencing, that is helping to increase the number of folks who are protected in our community.
Thank you, Dr. Kane. I believe we've got a follow-up from Abdul as well. Abdul.
Yeah, Mr. Mayor Paul Babcock, this is for you in particular. As we sort of ease these restrictions, let more folks congregate and participate, what is it going to be the rule for bars and restaurants? They still have to close at 1 o'clock, or can they go back to their regular sort of pre-COVID operating hours?
I'll take that. Yeah, Abdul, as I mentioned to Russ, we lifted those restrictions on the last order, so it should be up, and you can take a look at that for
okay.
follow-up.
We also have a follow-up from Leslie with IBJ. Leslie?
Hi, thank you. I also have a follow-up on the combined kind of vaccinated/diagnosed immunity rate being around 80%. So if that has kind of an implicit time limit by virtue of how long that immunity lasts, how long-term is the plan for this percentage? Because it seems like
so Mary, yeah. So Mary, what we're hoping is that at least it'll give us a 3-month protection, and so we're looking at with that 3-month protection that our vaccination rates will go even higher per month by at least 10%. So initially we can reopen, but if we continue to vaccinate, and our vaccination rates will go higher, and we think they will go higher, because we just recently had FDA authorized Pfizer Bionet company to do vaccinations of children between the ages of 12 to 15. And that just happened last week. So we're going to be adding a significant number of folks to our community being vaccinated. And we hope sometime in the summer, possibly in July, I think is what folks are looking at, June or July even, that we will also be able to extend vaccinations from 6 months and older for everybody to be vaccinated. So we think in that summer that by July, we will have a significant larger number of individuals in our communities being vaccinated in terms of protecting our children.
Right. Well, thank you, Dr. Kane. I think we've gotten to everybody's follow-ups. Stay tuned for a press release and the slides via the Marion County Public Health Department. So that'll be out fairly soon. Otherwise, we'll probably see you in a couple weeks for our next update. So thanks, everybody, for tuning in.